Hi, good afternoon, good evening, nurses. We're back again for another nursing Q&A and review. So we have a couple of questions prepared for you. First, we have a question here. A client with atrial fibrillation who is receiving a maintenance therapy of warfarin sodium has a prothrombin time or PT of 35 seconds and an international normalized ratio or INR of 3.5. On the basis of these laboratory values, the nurse anticipates which prescription. Number 1, adding a dose of heparin sodium. Number 2, holding the next dose of warfarin. Number 3, increasing the next dose of warfarin. Or 4, administering the next dose of warfarin. So, in this kind of question, um, the question is actually asking if you know first the normal levels of these laboratories, prothrombin time and INR, what is atrial fibrillation, and then what does warfarin therapy or what does warfarin do to our body, what are the risks and whatnot. So first, let's learn what is atrial fibrillation in just a quick um, quick explanations. Atrial fibrillation is a type of heart or arrhythmia or dysrhythmia wherein instead of the atria pumping blood, what happens is it's just quivering. So quivering, so technically if it's just quivering, it might not be able to pump the blood fully, and if the blood is not pumped, there's a tendency that it's in stasis, or it will just congest and in stasis, it's not moving. We know that if blood is not moving, it can cause clots, and therefore we have the warfarin therapy. Warfarin is an anticoagulant. It prevents clots, therefore that is really the main therapy or the main medication that is used for atrial fibrillations and diseases that can actually produce or has higher risks of creating clots. But of course, there is a normal value for prothrombin time. Prothrombin time is one that we measure whenever we're taking warfarin therapy. And the normal prothrombin time for a normal person is 11 to 12.5 seconds, and it's supposed to go up by 1.5 to 2 times when you are taking warfarin. So if you're going to multiply it, then we're expecting about 22 to 25 seconds prothrombin time. For the patient, we have 35 seconds, and it's too high, and it's already giving the patient a risk for bleeding. And therefore, what we're going to do, are we going to increase the dose? Are we going to hold the next dose? And adding the dose for another anticoagulant like heparin, or administer the next dose? We should hold the next dose of warfarin because there's high risk of bleeding. That's question number 1.
Hi everyone. Today we are going to again answer some nursing questions, and let's try to rationalize it and check the correct answers or review the correct answers. So I have 3 for this video. Number 1 is, I will read the question. The nurse is caring for a client with heart failure. On assessment, the nurse notes that the client is dyspneic and crackles are audible on auscultation. The question is, what additional manifestations would the nurse expect to note in this client if excess fluid volume is present? So, before natin sagutin, balikan natin yung mga clue words or mga key information na nasa question. Number 1 is the patient is experiencing heart failure. Okay, so we know heart failure, it's more on congestion, fluid volume excess. So, sinabi din dito that the patient is already experiencing dyspnea, which is, ang reason yan, probably, nagkaroon ng congestion sa lungs, right? Left-sided heart failure. And may crackles then, which is, crackles is a breath sounds that can be a sign of pulmonary edema, right? So, ibig sabihin, may tubig na, congested na yung baga, and the reason is heart failure. Na ano pa yung additional manifestation? A, weight loss and dry skin. B, flat neck and hand veins and decreased urinary output. C, an increase in blood pressure and increased respirations. D, weakness and decreased CVP or central venous pressure. So, letter A, weight loss and dry skin is not the best answer because if you are having congestion in your body because of buildup of fluids, most likely you will have weight gain and not weight loss. Second is flat neck and hand veins. Again, is not the best answer because usually if you have congestion in your body, it is not flat neck veins. It's actually distended. So, engorged yan, makikita mo because of too much fluid in your body. Number 3, or letter C, is increase in blood pressure. Always remember, volume goes with pressure. So, if there is increased volume in your body, increased congestion of fluid, automatically the pressure increases. That includes your blood pressure. And letter D, decrease in central venous pressure is again opposite ng letter C. Kasi kung meron kang increased blood pressure, dapat increase din ang central venous pressure mo. So the answer would be letter C, increase in blood pressure and increased respirations. And we have another question here. Here's the question. The nurse is preparing to care for a client with potassium deficit. The nurse reviews the client's record and determines that the client is a risk for developing the potassium deficit because of which situation. Again, pause. Before you answer the question, let's go back and check the keywords. So we are talking about a client with a potassium deficit or hypokalemia. Mababa ang potassium. Okay? The nurse reviews the client's records and sabi dito, what situation would result to hypokalemia. So let's review the choices. A, sustained tissue damage. B, requires nasogastric suction. C, history of Addison's disease. And D, uric acid levels of 9.4 milligram per deciliter or 559 micro per liter. So, we are talking about potassium deficit. So, what situation would result to potassium deficit? Definitely not letter C, Addison's disease. So, Addison's disease is a disorder where you have decreased corticosteroids, decreased internal steroids in the body. So, pag bagsak yung steroids mo, mostly bagsak ang sodium mo. Diba? Mineralocorticoids is one of the corticosteroids in the body, and pag bagsak ang mineralocorticoids, bagsak ang sodium. Always remember the principle of PISO. Ano nga dyan? Potassium inside, sodium outside. So most of the time, not all of the time but most of the time, if the sodium is down or low, sodium is up. So if you have Addison's disease, your sodium is down, you have hyponatremia. So the opposite na nangyayari sa potassium, you will have hyperkalemia and not hypokalemia. So it's not the best answer. Another one is uric acid level of 9.4. This is an indication of hyperuricemia. Okay? Mataas yung uric acid. And remember that if you have hyperuricemia, most of the time you will also have hyperkalemia. So, we are talking about hypo. So, hindi ito yung tamang sagot. A, sustained tissue damage, or letter B, requires nasogastric suction. Okay, so ito madali lang. Kasi kung isipin mo, ang laman ng tiyan mo, mostly ay potassium yan. So kapag, if you require suction, isa-suction mo yung laman ng tiyan mo palabas, you are also suctioning potassium outside of your body. Therefore, you will absorb less potassium and it will result to hypokalemia. So here's the question, and let's read it carefully. Okay? The nurse reviews a client's electrolyte laboratory report and notes that the potassium level is 2.5 milliequivalents per liter. So, before we answer this, let's go back to our knowledge of the normal laboratory values for potassium. Potassium's normal value is 3.5 to 4.5 milliequivalents per liter. So in the situation, 2.5 milliequivalents is technically low, right? Mababa talaga yan. Hindi siya normal. Okay, the question is, which patterns should the nurse watch for on the ECG as a result of this laboratory value? Select all that apply. So ito yung nakakakabang tanong kasi pag tinanong ka ng select all that apply, posibleng hindi lang isa yung sagot. Tama? So let's see. A, U wave. B, absent P waves. C, inverted T waves. Or D, widened QRS complex. Okay, so lagi kong tinatandaan lang dito is pag potassium and ECG, usually dalawang wave, actually tatlo, pero for this purpose ng video, dalawahin lang natin, okay? Dahil may kinalaman to sa choices natin. So, U wave and the T wave. Okay, so let's start with the T wave first. So, K is equals to T. Yan ang lagi kong tinatandaan. I think one of my professor before told me this technique that K is equals to T, which means K is potassium. It's the Latin word for potassium, diba? Kalium. So, if K is higher, T is also high in the ECG wave. So, normally, T, may normal range lang yan. But if you have hyperkalemia or mataas ang potassium mo, the T wave is high or peaked. Also, on the other hand, if your potassium is low or you have hypokalemia, your T wave is either flat, or inverted. Flat or inverted. Pababa naman yung wave. So, that's one sign of hypokalemia. Another is U wave. So, if we are familiar with the normal ECG tracing or normal ECG wave, wala talaga tayong dapat makikitang U wave, right? Kasi meron lang tayong P, Q, R, S, T. P for atrial depolarization or contraction, QRS for ventricular contraction or depolarization, and then T wave for ventricular relaxation or repolarization. Normally, wala talagang U wave. So, tandaan mo, pag may U wave, hypokalemia yan. Okay? So, our answers are two, U wave and inverted T waves. Those are related to hypokalemia.
Hi everyone, good afternoon. So today is a nursing quiz day again, and I have noticed that I gained some followers since I started doing the nursing quizzes. So let's do it again. Okay, so we have one question here. Let's do this in 3 minutes. The nurse reviews the arterial blood gas results of a client and notes the following: pH, it's 7.45, PaCO2 30 millimeter mercury, and bicarbonate of 20 milliequivalents per liter. The nurse analyzes these results as indicating which condition. So we have 4 choices here. We have metabolic acidosis compensated, respiratory alkalosis compensated, we have metabolic alkalosis uncompensated, and respiratory acidosis uncompensated. So first, before we answer this question, we need to know if the values are normal or not. So for pH, we have 7.45. The normal is 7.35 to 7.45. So technically, this is within the normal range. So let's settle with that. This is normal, okay? And we have a PaCO2 of 30, and we know that the normal value is 35 to 45. So 30 millimeter mercury is actually lower. And the bicarbonate is 20. This is also lower than the normal value of 22 to 26. But whenever I answer this, I always look at the values and also see what the values mean. PaCO2, it's carbon dioxide, and carbon dioxide is technically an acid. So if the values are higher, then the patient may be having acidosis. Okay, if the bicarbonate, so bicarbonate is actually alkaline. So if we have higher values for bicarbonate, then it means the patient is experiencing alkalosis. Now let's see. PaCO2 is what we have mentioned, it's lower. So it means that it's not acidosis. Kasi lower siya. So we can conclude that it's acidosis if it has higher than the normal value. So if it's lower, PaCO2 says we have alkalosis. While bicarbonate says since it's lower than the normal, bicarbonate is alkaline. If it's lower than normal, then bicarbonate says patient has acidosis. So PaCO2 says alkalosis, bicarbonate says acidosis. What's the correct answer? In that case, we need to go back to the pH and look at the value. Yes, this is normal. 7.45 is normal, but this is borderline alkaline. Therefore, we're going to follow the alkalosis path. And who says it's alkalosis? It's PaCO2. Right, it's alkalosis based on PaCO2, and if it's PaCO2, therefore this is respiratory alkalosis. The question is it compensated or non-compensated? What do you think? Of course, it's normal. The pH is normal, so it means that there has been a compensation going on. So this is respiratory alkalosis compensated. That's the correct answer. I hope you got that correct. So let's wrap this up. Thank you for tuning in, and let's do it a lot more in the future.